Welcome to Deuk Spine Institute. Our patient has torn muscles in the top of his buttock. These are called the piriformis muscles. And when they tear, they don't heal themselves. The only way to get them to heal is to basically be inactive and do nothing but lay in bed for months. That's not going to happen. Nobody can just lay in bed for months. You just get all kinds of other problems. So, how do we deal with this? The truth is, most people don't. They basically just live with the pain and deal with it by avoiding any activity that makes it worse. But it becomes unbearable for people to deal with the pain and have a life full of horrific pain. So Deuk Spine Institute and myself, we developed and patented a new treatment for this torn muscle called the Deuk Piriformis release. The idea of releasing a muscle or myotomizing a muscle, cutting a muscle, is not new. I did not pioneer cutting a painful muscle. It's a known treatment for spastic muscles. It's been around for many years. Show us where the muscle attaches, Jordan. It inserts right here, right there, along the top of the greater trochanter. And it gets torn in the middle of the buttock, and it's extremely painful. And it's the third or fourth most common cause of pain in the back. A lot of people call it lower back pain, but it's really more or less in the top of the buttock. You can kind of see the muscle on the x-ray usually. You can barely make it out. Sometimes it's very faint. Now this is a very, very well-developed, muscular young man. And he has had debilitating pain in the top of his butt cheeks. And as I said, it's piriformis syndrome. There's nothing else that does that. We've just treated his left side. We're going to go and treat the right side next. But Henry, let's show the audience why people get piriformis syndrome and how we deal with it.
Of course.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk Piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk Piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from our video that the muscle is torn through an injury. And the injury is typically an overstretching of the muscle by moving the leg and hip. And most people, I can tell you, the way they injure this is by bending over and twisting their hip at the same time. All right, so we've already fixed his left side. We're going to the right side next. Everything is going great for him, but he travels here because he's suffered with pain for a long time. And the pain he's having is coming not just from the piriformis muscles, but also from his discs that are damaged and sacroiliac joints. Now we just finished treating his SI joint, so now we're going to focus on the piriformis muscle. We've already done one side. He has bilateral tears. I think the right side is worse, if I'm not mistaken. shot. I've got to get down to the docking point, which is the point on the bone right there, right at the tip of my probe, right where I want to dock on the bone. I could feel it now. He's got very well developed gluteus maximus. And that's one of the things to keep in mind. When we're not the first facility to do what's called a piriformis muscle release, okay? They've been done for many years, but the way they've been done in the past is cutting the entire buttock open with a huge incision. And that is a very painful, very damaging procedure. I wonder if my incision is just too small. I think we're okay. All right, if you have questions, I'm happy to answer them for you.
Yes, we have a question coming from,
Oh, you didn't shave it down.
this is coming from Ramazan on YouTube.
Ramazan?
Correct, Ramazan.
Come on, Ramazan, bring your question.
Saying, hi, Henry, and hi, Dr. Deuk. Is there any cervical neck surgeries available today, and can we that we can watch?
Oh, I wish. Not today, my friend. Today, this is our last surgery. You know, we operate on whatever happens to come through our doors. And this week is a slower week for us. But I apologize, there's no cervical. The cervical that was supposed to be done today changed his mind and decided to do his lower back instead. So that's why we didn't do a cervical, we did a lumbar. That patient is almost ready to go. Yeah, he's doing fantastic. No pain. Pain is gone. All right. You've shown the audience how we do this piriformis release, correct?
Yes, we did.
And you all understand, once the muscle is injured, it is almost impossible. 31 minute left. It's almost impossible to heal. The muscle just doesn't heal itself. So, the only way to get the muscle to heal, the only way, is to release it. That's why doctors have been doing this treatment for years. The only problem is they do it open, with the patient's buttock filleted wide open. And it's bloody and painful for the patient. Horrible pain. Yeah, it's incredibly disfiguring because the butt literally shrivels up and dies. The gluteus dies. You get a big old scar. All right, I'm pretty happy so far with this. I'm just making sure I'm going deep enough. I'm going superficial enough. I'm going to the top and bottom. And I think we've got them all. All right, we got all the scar tissue that's in there. So what happens is the muscle tears, and then it develops scar tissue that's full of inflammatory scar tissue that's very painful. And then people get horrible pain right there at the top of their buttock. Literally right here. You can push right there, and the piriformis gets activated. If it's torn and painful, it'll recreate the pain for the patient. All right, thanks for joining us. If there's no other questions, we'll end the live stream.
Oh, we have a question coming from, two questions. One from Pawn Lust on YouTube, asking, how is the neck patient doing from a few days ago?
Doing amazing. She's doing amazing. She was doing fantastic the next day. Very happy. Symptoms were gone. She's doing great.
And then lastly, from Faisal, once more on Facebook, asking, Doctor, your laser surgery on the discs. I see Wuradol Spine Hospital in Asia that does something similar that you do and are very well recommended. Do you train with them?
Yeah, great question. So Wuradol Hospital was founded by a neurosurgeon, Dr. Sang-Ho Lee. He was the founder. He's a neurosurgeon. He trained me on the endoscopic technique, but not the laser. The laser, if they're doing what I do, then they've learned it from me, from watching my videos, and they have started doing it themselves. But I'm the pioneer on the laser. He's the pioneer on the cervical endoscope. So he's taken my technique if they're using laser.
And that is it for questions.
All right, thank you.